Right, a warm welcome to those of you who are joining online. We're about to start, and we're just under 2 minutes away from starting this special session of the Reach Network. This is a network created from the Teach to Reach community, and we are very pleased to be holding this meeting following Teach to Reach 11. This is the first time that the Reach Network is reconvening following Teach to Reach 11 and ahead of Teach to Reach 12, which we'll be announcing in the coming days. So today we're going to be focusing on this issue of climate health risks and barriers, and in particular we're very pleased to be launching with the Reach Network this global climate and health survey. We'll tell you all about it in just about a minute. In the meantime, I see that Charlotte Mbou, my co-host, has arrived. A warm welcome to you, Charlotte.
Thanks, Freda, and hello, everyone. It's a pleasure to be here today.
All right, wonderful. And so we're kicking off in just under a minute. Len, we have lots of questions for you because we're going to be showing you the survey, actually trying it. We hope we're going to give that a try, and so you can see what it actually looks like for those of you who haven't taken it. And then we'll be introducing the Teach to Reach survey partners. So if organizations have been invited to become partners for this global climate change and health survey. Here we go. All right, a warm welcome to you from Geneva, Switzerland. I'm Reda Satki, and I'm here with Charlotte Mbou. Today we are going to tell you all about climate health risks and barriers, and this is an introduce the Reach Network. This is peer learning for health leaders. It is part of an ongoing collaboration with Grand Challenges Canada around climate health risks and barriers, and today we're very pleased to be launching with the Reach Network. So Reach is Relate, Engage, Act, Connect, and Help, and it is made up of health leaders from the Teach to Reach community, this global platform, community, and network dedicated to working for health. The partnership with Grand Challenges Canada is significant for us. We're committed to learning from those who are on the front lines of health crises as the basis for why Grand Challenges Canada made this commitment and is supporting the Teach to Reach process. We're grateful for that support. Now, for those of you who have poor connectivity, who may get disconnected during this session, we encourage you to connect with the podcast at www.learning.foundation/podcast, and also to follow us on social media. So I mentioned Teach to Reach. We're going to ask Charlotte to tell us in one sentence, what is Teach to Reach exactly?
Teach to Reach is a platform where healthcare workers from around the world, they meet, they connect, and they learn from each other across various topics that directly influence their day-to-day work. Yeah.
Thanks, Charlotte. And now, Reach for Leaders is Relate, Engage, Act, Connect, and Help. And this is specifically for health leaders. So we want to know from you, what is the Reach Network again in one sentence? I'm going to turn to Gordon Yibi from Ghana. A health leader from Ghana who's been there since the beginning of Teach to Reach in January 2021. Gordon, would love to hear from you, to have you introduce yourself and also sum up for us in one sentence what is the Reach Network. But I see Gordon is not yet. Okay, there he is. Gordon, please do introduce yourself. We know you as an immunization leader, and here you are contributing to critical work on climate change and health. Can you introduce yourself, tell us how you work for health, and then tell us in one sentence, what is the Reach Network?
Thank you, Dr. Reda. My name is Gordon Yibi from Ghana. I'm an organization leader. I work as a technical officer, disease control, prevention, and surveillance. I think the Reach Network seems to look at networking, a network that connects leadership of health workers across the globe to support each other in sharing knowledge, experiences that will help solve events or disease burdens that probably have been made successful with the different innovative measures in one area that will also support individuals in their own local settings, if it is well adopted and tested. So in my little understanding, this is how I'll put it.
Thank you, Gordon. Now, just to say for others who'd like to speak, answer that question, or just to introduce yourselves, start by typing your message in the chat. Unfortunately, if you put an email or a phone number, we're not able to show it on screen, or at least we're not supposed to. Raise your hand, check your microphone and headset, and then unmute your microphone. And in fact, we are going to tell you a little bit more. Reach for Leaders is special networking for health leaders, one-on-one meetings, and then a dedicated communication channel. So we invite you to join us in leading change. Just to give you a sense of the Teach to Reach community, you can see the numbers here. Starting in actually January 2021, you can see the growth of Teach to Reach. In December, we had 24,610 participants registered for Teach to Reach 11. Most of you work in health facilities and districts. Half work for government, half for civil society, half speak French rather than English, and then 1 in 5 face armed conflict. You can see that the people participating, the health professionals participating in Teach to Reach, are very much, this is what we mean by the front lines. Now, we're just going to mark a pause to share some greetings here. Let me see if we can get at least a few of your messages coming in from the Teach to Reach, let's say, universe. So we have, I see, Abdullahi Ahmed Kangiwa says, reach generally refers to the extent or range of influence, audience, and distribution. All right, thanks, Abdullahi, for the dictionary definition. Emily Christopher greets us from Nigeria. Okechi Nzedibe says, interesting, watching online. Asegede Kebede from Ethiopia. It's nice to know who you are. Tell us what you do, how you work for health, and why you're here, why you care about this issue of climate change and health. Mohammed Omar Sakwa, Tafurodo Mutange, so Bauchi State and Kenya represented. Abdul Rahman from Abuja, who says he's glad to be here. Tell us why, Abdul Rahman, if you will. Beatrice Eka Kitie from Nigeria. Mahesh Bhatt, a surgeon, public health consultant, and MD in India. Joseph Ngugi, and many, many others. We're going to stop here in order to tell you more about the Reach Network. So, Charlotte, can you tell us how at Teach to Reach, in the Teach to Reach community, we define what is a local organization?
A local organization is based in a community and has as mission to serve community needs, is led by community members, and is accountable to the community it serves. It could be a non-governmental civil society or a public organization or structure.
Indeed, and we've seen unprecedented scale and engagement back in June 2024 with the first time we invited local health leaders working at the level of communities, districts, regions, and 2,493 individuals, health leaders representing organizations participated. And you can see this has led to the Reach Network and many, many other outcomes, some of them more expected than others. You can see also that one specificity is this is not another CSO network. There are a number of very good networks of civil society organizations, but here the ambition is to connect government agencies at all levels and their leaders together with civil society organization and other nonprofit leaders, education institutions, advocacy groups, social enterprises. So you can see there's a wide range here. And to get a sense of which organizations are in the room and what we mean by health leaders in local organizations, I'm going to turn to, Charlotte, who shall we hear from to try to get a sense of who is in this Reach network so that we can hear firsthand.
Yeah, so
Hello, can you hear me?
I say, Umar, yes, Mohammed, we can hear you. And do not forget to introduce yourself.
Yes, thank you for the opportunity. I am Mohammed Nasir Umar. I work for JSI. I I am in Zamfara State, Nigeria. Actually, the biggest challenge faced by the community I support is the natural disaster that really affected the access of immunization. There is flooding that occurred during our last year SI activity, where we plan to reach a particular target population of people in the community, but we couldn't because of the flood. However, we took that upon us and re-strategize, and we were able to meet up, but actually that was a great challenge. Now, talking about how my organization helped to mitigate that particular gap, we supported and we provided TA support to the RI working group at the local level. We reactivated the team. We mobilized resources, and we're able to organize a medical outreach, an integrated medical outreach. We map out the affected community and settlement, and also we reach out to the community with particular services, immunization services, and other materials just to cushion the effect of the flooding. Thank you for this opportunity.
Thank
That
you
is all from
very
my
much
end.
indeed. All right, so now we're going to go have a look at exactly what are the benefits of joining the REACH community. Then we'll be introducing not the REACH community organizations, but actually the first batch, if you will, of survey partners for the Global Climate and Health Survey from the Teach to Reach network. We're very much looking forward to that. But first, to tell you a little bit about the benefits of becoming a Teach to Reach partner as a health leader, of participating in the REACH network. Charlotte, we say that your team's daily work makes you experts. How does Teach to Reach help with that?
Teach to Reach gives you the opportunity to share the knowledge that you have. And that knowledge is based on your day-to-day experiences and your ability to solve challenges that you face on a day-to-day basis. And coming together as a group, and depending on the collective intelligence of the group, we are sure that you are able to become potentially an expert in your field.
The second benefit is to learn from other organizations. As an organizational leader, you can take what you learn from the sharing of experience at Teach to Reach and in the REACH network, which is specifically for health leaders. Every organization can teach and learn at the same time. And Teach to Reach brings organizations together to make bigger changes than any one group could do alone. And the fourth benefit is really, if you are an organizational leader and your organization is sufficiently mature, you have a team. They may be staff, they may be volunteers. So really, Teach to Reach provides an opportunity to grow your team skills through active learning, really by practice, sharing their ideas with people from around the world, learning to give helpful feedback to other health workers, getting better at explaining your work to different audiences, and developing skills in thinking about and improving your own work. So now we are going to come to the presentation of the first batch. There are many more coming in. These are the ones that we've had time to review and make decisions on, the Global Climate and Health Survey partners. So we're going to go to that list. Let me just make sure we're set up to do this in our studio, to do this properly, to appreciate and honor your work. So here we go. And so these are the first organizations that are joining as partners for the Global Climate and Health Survey. Here we go. And these are both Francophone and Anglophone organizations. In alphabetical order, so you'll see all the countries together that are being represented and that are joining the Global Climate and Health Survey as partners, recognizing that if this is about local communities facing the impacts of climate change and health, then this is about the organizations that people in local communities form, create, to really express, to take collective action to face the challenges that are before you in your local communities. So we want to warmly welcome you to this partnership, and we hope that you will find it useful to share this survey with your communities, with your staff, with your volunteers, and with your beneficiaries. And we'd like to call on, especially if you are one of the organizational leaders who committed your organization to becoming a partner for this climate change and health survey, we would like to ask you to raise your hand if you are in our Zoom studio, and of course to leave a message if you're watching, because we are live streaming this session across let's see, Facebook, LinkedIn, X, and I think there are a few others, but so we'd like to go to Mahesh Bhatt. Mahesh Bhatt has been a frequent contributor to the Teach to Reach community. We appreciate leaders who consistently step up. And then we also have Abdul Muttalib Aliyu. So I think that hand went down. Mahesh, always a pleasure to hear from you. Can you tell us why your organization, first introduce yourself, and then tell us why your organization decided to respond to the call to action of this Global Climate and Health Survey and to become a partner, not just you as an individual or your colleagues filling in the survey, but saying, as an organization, we are committed to this.
Hello, Reda. Charlotte, and all the friends, all the frontline healthcare workers, leaders from all over the world. Good afternoon. I am here in India. So good morning, good afternoon, and good evening to all of you, depending on your time. So I am Dr. Mahesh Bhatt. I am a surgeon and public health consultant, and I am MD and CEO of MMB SHS Trust. This is an NGO, and we are working in the Garhwal Himalayas of Uttarakhand state, which is a northern state of India. It is in Himalaya. We are working in the Himalayan terrain, the villages and the small cities, you can say, small towns in the Himalayas. So our focus is on the public health literacy, health promotion, health education, and naturally, since we are working in the Himalayas, so climate change is our, we are coming across to the issues of the climate change and its problems continuously during our work. MMB SHS Trust is a volunteer-based trust. We have around 2,000 volunteers with us, and they are many of them, they are physicians, nurses, and even the college going students, teachers, local leaders. So this is a volunteer based organization.
Sure.
Uh,
Mahesh,
Primarily,
just
yeah.
keeping in mind, being mindful of the time, could you tell us exactly why, so we understand your organization, why did you decide to commit your organization to become a partner for this global climate change and health survey?
Yes. I was coming to the point,
All right.
and yeah. So that was they since we are working in the climate change and health, and it was a great opportunity. We look into it as an opportunity to interact with the people from all over the world and learn from their knowledge, what they are doing, and we also want to take this global knowledge to our local issues. Thank you very much.
All right, thank you very much indeed. If there are other organizational leaders who are in the room, we'd love to hear from you as well to understand why and how. I see Esther Yakubu has her microphone unmuted. Esther, please go ahead. Can you tell us? Introduce yourself, introduce your organization, and then tell us why your organization sought to become a partner of this global climate change and health survey.
Hey, thank you very much, Ryder. Greetings to everyone in the house. My name is Esther Yusuf Yakubu. I work with Health and Development Support Program. Our office is situated in Jos Plateau State, Nigeria. Well, why our organization decided to join the Partnering for Climatic Health globally is due to the fact is climatic change affects humans in diverse means, and it increases the outbreak of diseases, which makes an individual incapacitated when it comes to type of productivity. And we feel, if not partnering to join hands to bring this to a control, the society will not be very comfortable for everyone to live, to grow, and to develop. And all what we desire for human beings as an organization is to have a healthy life. Because the saying that goes, a healthy society is a wealthy society. So for us to be wealthy, we need to be healthy, to have a healthy life, both physically, environmentally, and otherwise. And so we pick it as our goal to ensure that people have quality health, be it going to the primary health care, a secondary institution, or the tertiary institution. Let the service be a qualitative so that this climatic change will not affect human, physically, and socially. Thank you.
Thank you very much indeed. All right, we're going to go to the first question of a set. So if you participated in the consultation for the pilot survey group, you've seen these questions before, but they are new for the REACH network. Of course, there is some intersection, some overlap. First of all, have you completed the Global Climate and Health Survey? That is, of course, the first question. If you did, then what surprised you? And if you did not, why? Yes, what are you waiting for? And we'll be sharing more about the exactly how to take the survey. Everyone here should have a, but for those of you who are eager to get started, because we are receiving some requests via social media and other places. So Charlotte, shall we hear from first to answer this question? Have you taken the survey? And if you have, what surprised you? If you have not, what is holding you back? What is the barrier, if there is one?
I saw Cynthia Niera said in the chat that he had taken the survey, so he answered yes. Kingsley, I don't know if you're able to speak. You're unmuted.
And Kingsley is another very much appreciated and really one of the most senior leaders in the Teach to Reach community. So it's always a pleasure to hear from you. I also want to encourage those of you, before we went live, we actually had the pleasure of hearing Linda Kalumbi from Malawi. I know she's actually in class now, but if Linda, you can still hear us, we'd love to hear from you. And we always appreciate hearing from senior leaders. But if this is your first time or if you're new to the Teach to Reach community, we would very much appreciate hearing from you as well. Kingsley, you had already taken the survey, I believe, when we spoke to you 2 weeks ago. What would you like to update us on now? And perhaps you want to tell us why introduce your organization again, why your organization has committed to being a partner for the Climate Change and Health Survey.
Thank you so much for the opportunity. My only executive director. Yes, I'm Kingsley Kofi Ningere. I work for Community Youth Development Foundation that is based in Ghana, specifically Kintampo in the Bono East region of Ghana. Yes, Community Youth have decided to join this global platform for climate change and health because climate change has now become an order of the day that the whole world is trying to develop strategies and plans as to how to combat climate change mitigations. So Community Youth Development, which has been a strong advocate of climate change, we have decided to join the global climate change platform so that we can help develop strategies. And then we can also help to plan ways and means to mitigate all activities that leads to climate change. So I have taken the survey, and then it was a good exercise, of course. But what surprised me so much with regards to this survey has to be with trying to develop strategies and mitigation to climate change effects. At times there are barriers to these particular effects. And what are these barriers? At times, bylaws in the community are not all that strong to bring perpetrators to book. For example, when you come to the vegetation, the manner in which community members are falling down trees for charcoal, and also the way the hunters are burning bush just because of game or bush animals. At the end of the day, what happened here is that most of people's or farmers' farm produce are burned or are consumed by wildfire. And that is why was in a Community Youth Development Foundation said, no, we can never wait. While Global Health is there to take up this particular challenge in order to advocate for community members change their behavior in terms of climate change. That is why we have decided to join the Teach to Reach platform or the global platform. Thank you very much, Reda, and I'm over.
Thank you very much indeed, Kingsley Niniere from Ghana. Charlotte, we have many messages that we would love to share, including some people not just saying hellos because hellos are nice, but Kingsley in fact had said, my challenge is indiscriminate cutting down of trees and bushes fires. Let me see. Yeah, and then Dr. Tusimi Ramadan from Uganda. The biggest challenge faced by my community is misinformation, and we're trying to sensitize communities. So want to acknowledge some of the organizations joining, such as Ugo Chukwu, Madu Bueze, who represents the Women's Association of Nigeria, the public health physician. Let's see if we can go to Ugo Chukwu, Madu Bueze. But I see it as her AI note taker who is here. So Ugo Chukwu, I hope you are physically present. We'd love to hear from you. And here, first of all, to introduce your organization, tell us why you are joining. I believe you have committed to joining the survey as a partner. If that's not the case, apologies, my mistake. But we'll, and then to tell us if you've actually completed it. If so, what surprised you? If not, why haven't you done it yet? What has prevented you from completing the survey yet?
Okay, thank you very much. Good day, everybody. My name is Dr. Ugochukwu Adeboyeze. I'm a public health physician. I'm also the Assistant National Coordinator of the Medical Women Association of Nigeria. The Medical Women Association of Nigeria is an NGO of female medical doctors in all 36 states, including the FCT in Nigeria. So we do a lot of community services. Something that has surprised us is the rate at which an outbreak of cholera has been coming up in rural areas. And this has been as a result of shortage of water, which we've noticed that sometimes when the flood comes, it finds a way of getting infected water from burst pipes, latrine toilets across into the community. So this has been a very huge challenge, which we've been trying to find a way around this challenge. I've actually filled the survey, and was quite straightforward and mind-blowing and interesting. Okay, thank you very much.
Thank you very much indeed. Just one more question for you. So can you tell us, so how is your organization going to share the survey with your membership or with your stakeholders and networks?
Okay, I will do that. I'll do that following this meeting. I didn't really share it across to stakeholders, but we do a lot of stakeholders engagement in the community and within the State Ministry of Health. So we'll go ahead and do that and get more ideas on how to move forward. Thank you.
All right, wonderful. Next, I'd like to go to Pamela Njeru. Pamela, you are the chair of Upendo Care, which is a community-based organization in Kenya. I hope you'll be able to speak to us and tell us about your organization's commitment. Pamela, I'm asking you to unmute. Yes, please go ahead.
Okay, my name is Pamela Njeru from Kenya. I'm the founder of Upendo Care, CBO, where I'm the founder and the chair of the CBO. I came up with this organization because of seeing how things are not going well in the community. So the issues of health, environment, because of climate change, so that I can be able to give the information to the community around me. So I had so many challenges starting it, but I joined my hands with a team of 20 people, and then we started the organization. I showed my dream and vision and objective of the CBO to those members, and they accepted very well, and that's how I started the CBO. So I've been working with that CBO for the last 2 years, mostly on health, environment, and climate change, trying to educate the community, giving information to the community on changes of climate, issues of health that are caused by the change of climate. But the challenges are there because mostly of the beliefs, ignorance, bad policies that have not been enforced in the community. So we have a lot of challenges, mostly like when you're telling people do not cut trees, plant more trees. They see as if you're refusing them to get money from those trees, but you're trying to prevent the risks and dangers of cutting all the trees in the environment with not planting others. So those are the challenges that I faced with my organization. And that's why I said I will send the survey to all my members so they can see. But I started sharing with them about Teach to Reach from when I joined it, so they can understand what is it, what are we doing there. And they're happy because of the survey that I did last time, the one we are talking about today.
Yeah.
And they are ready to join. I'm training them on other things that I've learned from other people that I met in this global platform. It's a good platform that I've met many people from different countries, learning from them, knowing the challenges in various countries, and knowing even better things that I can do here in Kenya, in my community. So that is what the organization is doing here in my community. And I'm happy to be one of the people that joined Reach to Reach sometimes back. I've learned a lot. And I'm ready to continue with my organization, working together, sensitizing the community about climate change. and other risks that come with climate change. Thank you for this opportunity.
Thank you very much indeed. That's a wonderful, beautiful testimonial. We're now going to go to Eunice Goshomi, who's a research programs leader at the Women's University in Africa. Eunice, would love to hear from you about your organization's interest and commitment in this global climate change and health survey, and of course, as part of the Teach to Reach community. First of all, a warm welcome to you. We'd love to hear you introduce yourself, introduce your organization, let's say concisely, and then tell us why your organization is committing to this global climate change and health survey. All right.
Yes. Yeah. You hear me?
Yes, loud and clear now.
Okay. I'm Eunice Goshomi from the Women's University in Africa. The research programs leader. It's like it's a university, a high institute of education, and then we have students which we are second to the community, and then we follow them up, and then we do a lot of research. So joining this are the climate health issue.
Yes. So what Eunice Goshomi? Yes.
We are saying what to also to maybe to us to assign students to do climate related studies so that we have. Yes, you hear me?
Yes, I think there is a delay, but just keep going. Tell us why your organization is committing to this survey, and what surprised you, if anything, about the survey.
So it's like what surprised us as the survey.
Yes.
It's like it didn't actually focused much on the issues to do with evidence generation, though maybe some of the issues and then of the budget. It's like it's missing when we attach our students in the in the community where they're dealing. It's like a midwife where they're dealing with pregnant women. And then there's a lot of malaria cases, and then there's and then resistance to treatment. And then also what also surprised me was when we deal with the community, it's like the clearing of the surroundings, and also maybe dumping of materials which have wet water, and then you find that there's a lot of malaria around, but which where we can also avoid that through clearing the environment. And then also mosquito bites are a problem in the under fives and then the pregnant mothers where they suffer severe malaria. And then it's like want to, as an organ, also community engagement, and then to solve the issues to do with climate change, and then their effect, and then its effect on health. So this is what why my organization joined this endeavor. Thank you.
Thank you very much indeed. Now, you received, if you're a member of the REACH community, you received this call to action on the 5th of February. And this was inviting you to that first check-in. And now we're scaling up, really sharing with the REACH community and the broader Teach to Reach community. So I'm going to walk through this. There's several steps or things to pay attention to. And then we'll be asking you to do a practical exercise as we go. So please be ready both to speak in response to the next set of questions that we have for you, or just to introduce yourself. And then please, if you can, follow along in order to be able to see what to really get the most out of this survey for your organization. And for those of you in particular from the research community for whom this can be quite important, we point you to the comment just published in the Lancet Global Health on the climate crisis and human health, identifying grand challenges through participatory research. So if you'd like to read this article, if you're interested from a research perspective, this is what you can look for in the Lancet, and that will give you some background about the survey. from a research perspective. Second is the actual launch press release of the global survey, Seeking Insights on Climate and Health. And there, what I'm going to do is I'm going to invite you to not just read the press release, but also do three things. One is to, I've actually already done it, but if you go to the, and I see Kingsley Nyeri has did it a while back. If you can, I can ask you to do three things. One, the first is to like, and you can actually do this right now because I've shared the link to the press release. So you can click on that link and then do three things. One is like, the second is share. So you can just repost to feed if you're on LinkedIn. And then, let me just try to make this reasonable size. Yeah, post it. And then add a comment. Yes. And this, I'll show you something special that you can do to get the attention of your colleagues and maybe even people from your organizations, but your network. So I encourage Charlotte and Boo to take this survey. All right. Or I challenge to take the survey, and I add that as a comment. So we're going to check. We saw how many were there. So there's 46, 22, and 16. I'm going to reload this page, and we're going to see if anyone of the leaders in the Reach Network has done this. Yes, we're now at 50, 24, and 16. Remember, the repost is actually one of the most powerful things that you can do. And then step 3, and really sharing the survey, is primordial. There are some countries, including countries with very large, sizable populations, that right now have 1 or 2 or 3 respondents. Even some of the biggest countries. So if you have not shared yet, even after you have completed the survey, it's very important that you share with your colleagues and also take the time to explain how you became sensitized on this question, why your organization has decided to support it, and then to actually help your colleagues follow through. We're all receiving tons of information, of calls to action for all kinds of surveys, all kinds of things that people want us to do, people in the organization want us to do. It's really that personal touch that can make the difference with your colleagues. So we called on the 5th of February, we launched a call to become an organizational partner for the survey. So if you are just joining now and you don't know how this works, simply register for Teach to Reach. I'll share the details on that in a minute. And you'll receive the invitation to take the survey and to become a partner, for your organization to become a partner. Now, very important, you have to ensure that your organization has authorized you to apply on behalf of the organization. So this is not something you can do as an individual. This is something that you need to be authorized by your organization to do. When you request your invitation for Teach to Reach, you get your personalized link, and then you can submit your organization's application. Now, I see a question from Mahesh. How can we know that how many people whom we shared the survey to took the survey? We'll be sharing a follow-up with everyone who's taken the survey so far from the Teach to Reach community, and indicating how many people from your country have actually completed the survey. That should give you an indicator. Of course, the data is confidential, so we can't share exactly what you're asking for, but that should give you a good indication. And then the partner selection criteria for becoming an organizational partner of the Global Climate Change and Health Survey is that your application be complete, that you confirm you're an authorized representative, of course, by the deadline. So the deadline will be found in the email when you request your invitation for a Teach to Reach and you get the onboarding instructions. You actually receive 4 different emails. There's one that contains the link to become a survey partner. We're trying to simplify that and will in the coming days. Then, of course, your application has to be reviewed and approved by the Geneva Learning Foundation. And then last but not least, we actually ask you to share, to document that you disseminated the survey announcements using what we call the dissemination register. So that is really, and just to show you how that works in practice, just to go, whoops, okay, looks like that's not going to work. Oh, I see, I pasted too much. Yeah, let me just try that again. Okay, And here you can see this is personalized, so you cannot just share the link with colleagues. You have to actually go and request your invitation for Teach to Reach, and that puts you into the process for both this survey, for other Teach to Reach activities, and really can bring your organization into the fold. Now we have just a few minutes left in this meeting of the Reach network. And so here we really should have two questions. If your organization is not yet a survey partner, we shared the list of the first batch of survey partners earlier in this session. Will your organization become a survey partner? And then if you already have, of course, as a number of you have already told us, then please tell us why your organization is committed to being a survey partner. So we're going to go to Charlotte so she can pick. There's a number of people, in particular women in the Reach network, whose microphones can be activated. So I think we should be very proactive, Charlotte, and either maybe deliberately pick people that we've never heard from and invite them to speak and encourage them to speak. And it looks like Charlotte may be having... Yep. Go ahead, Charlotte.
So I'm just inviting those that are here.
All right, let's try
I don't think we have...
Mary Caleb and Mary Obi, Mary Goretti, and Pamela and Patience, as well as Rebecca Bello, has been very actively promoting the survey. Emanuela Zamani. All right, and I see Beatrice says that she's taken the survey, and I see at least one raised hand. Let's see. All right, from Gifty. So we'd love to hear from you, Gifty. I think your hand just went back down. Yes, Gifty, and you are also a senior leader in the Teach to Reach community. So wonderful, always wonderful to hear from you. We know that you work with a specific population in your organization. Can you introduce yourself briefly? Remind us what your organization does. And then I believe your organization is amongst the partners. You're going to tell us why.
All right. Thank you, Mr. Reader. Thank you, Geneva Learning Foundation, for always giving me the opportunity. It's always a privilege. I'm Gifty Akostu Ajigbe, public health nurse in the Goma West District in Ghana. I'm also a disability health advocate. So my organization is Ghana Health Service, and we took the time to go through this survey. I share with my new digital director, as I promised the other time, because he's new into the public health sector, and he had this interest and really want to learn more. So I introduced him to the survey, and then he took the survey. So both of us decided to share with our colleagues, and so I would say his workers. So we are his workers, but my colleagues, that will share with them. And we realized that most of them were sharing some of the issues on the ground, because we have a lot of hard to reach areas here in my district. So in all, I would say it's an eye opener, because we intend taking all the feedbacks from them, which can also help us. Because as we speak now, we have a cholera outbreak. And so I would say I have been enlightened on Geneva platform already, because some people had this issue even before we had our own from November to date. So I use the experience that I got from the platform, and then I share with them how we could go about to do our sensitization, go into the hard to reach areas to teach other people, to educate in the schools, the food vendors. And I would say that it has really helped. Although we can't end it all, because we still don't have water in some of the areas here, but at least the number of people that could be infected actually reduced. And I would say it has really helped. So the survey, I would say we are putting our best just to reach everyone, to put all the feedbacks together, just to help us plan and implement something good in the future. Yeah.
Thank you very much indeed, Gifty. It's great to have this update, and we're really following along because we hear from you nearly every time. It's always a pleasure, and it's important to recognize the senior leaders in the Teach to Reach community, as well as to encourage those of you who are new to make your voices heard as well. Now, we do have this next question, and really we're going to focus on the practical activity as we wrap up this session. So first of all, you should see that I have shared the links to to share on WhatsApp. Okay, I see. Then I don't need this. I don't need this one. Yeah, to share on WhatsApp with one click. And I'll show you what happens when you click on this link. It's a secure link, and you can send to WhatsApp. You send a short message. Now, what I recommend is that you actually add a personal touch. Add something from you so people know that you're not just blindly passing on a message, but that this is something you actually care about. And then also, if you share on, if you are on Twitter, you can share on X. You can share this way, and you can see here that there is. You may have to shorten the message a little bit. Website, yeah, but that is a one click. Basically, in one click, you can actually get the word out to your colleagues. Of course, even better if you put on that personal touch. So what I'd like to ask is we're going to test this on LinkedIn. And so you can see the LinkedIn link here. And I think some of you have already responded. So let's try, let's try Facebook. So if you could click on the Facebook link, and you'll see here, no, I mean, and you can see right now there's 16 likes, 11 comments, and 20 shares. So I'd like to ask you if you could go to that Facebook page. Of course, if you don't use Facebook, then you can pick another service and do three things. It's really 2 clicks and a sentence, okay? The first thing we'd like to ask you to do is to like. I'm going to love. I think this survey is great. Second is to share. So I'll share the feed. Of course, I'm sharing in this case as the Geneva Learning Foundation, as I'm one of the admins on this page, but should be pretty similar for you. And then to actually add a comment. So I'm going to challenge Charlotte and Boo to take the survey. And we can turn this into a challenge. Maybe every person doing this challenge. So we were at 16, 12, and 20. So we're going to reload the page and see how many people have actually followed through. I see many. I recognize many familiar names. So we're now at 17, 12, and 21. All right, wonderful. And we'd like to hear maybe from one person before we close. I see Mary Goretti Otieno has had her microphone open for a while, as well as Husseini Abba. Mary Goretti, are you able to speak to us? I'd like to know, to introduce yourself, introduce your organization, and then tell us have you invited or are you inviting to take the survey? What concrete steps will you take to ensure effective communication?
Thank you, Reda. Thank you, Charlotte. I'm grateful to be here. I'm Mary Goretti Otieno from the University of Nairobi, Kenya. I've been with this foundation since the beginning, and I would like to invite my colleagues, especially from the medical department and the environmentalist, to take up the survey so that they share with us what they'll do. The concrete steps is to do what we are being told here: share through WhatsApp, share on the LinkedIn, share on Facebook, and this will enrich the data we want to gather from here for the benefit of the society. Thank you very much, Reda.
Thank you, Mary Goretti. Okay, over to Husseini Abba. Husseini, we'd love to hear from you as well. Introduce yourself, your organization, and tell us who are you going to invite, or who have you invited to take the survey? How many people, I think, is a really important question. And then what concrete steps? It's one thing to just pass on the message. It's another thing to make sure your colleagues actually do it. Husseini, how are you doing? Do introduce yourself first.
Okay. Good afternoon, everyone. My name is Husseini Abba, Executive Director, Pioneers Reproductive Health and Youth Association. It's a civil society organization working in the northeastern Nigeria. We are working in climate change, and what concerns me is regarding the excessive cutting down of trees, deforestation around, more especially around my area, in the name of farming and all this thing. And this is causing a lot of havoc to the environment, especially flooding and outbreak of diseases. So this is what makes me to join this team. Secondly, I invite my colleagues who are civil society organizations that are also into environment and climate change. My question here is I took my own survey personally, and I want to take this survey for the organization. Unfortunately, our website is not yet active. We are yet to complete the web registration. So what is the way forward for us to complete the survey and be as a partner to this climate change call? Thank you.
Thank you, Husseini. That's actually a really good question. We saw a number of questions from local organizations that don't have a website, and there can be many good, valid reasons for why that is. You can share a Facebook page or an X account. Both of those are free to create, that you can create for your organization. That can also be a resource for you. If really you don't have the capacity or the time or to do this, then just put the Learning Foundation website. We'll accept that. The idea is to be as inclusive as we can. So once again, thank you, Husseini, and I hope this will not, we don't want any barriers to stand in your way in order to participate in this international effort to gain insights into what is happening with climate change and health. So we're going to start the session for the Francophones. So we thank you for your participation, your trust, your confidence. We heard from many very senior, I'd like to say the ancient ones, our elders who've been with the Teach to Reach community since the beginning, and also a long-time commitment to the Geneva Learning Foundation. We also know that there are very fresh newcomers. We want to make sure you feel warmly welcomed to the Teach to Reach family. We're going to do a quick rewind of some of the messages that we haven't had time to show. So I believe Solomon now knows how to access the survey. Marian Mutange completed the survey. Not surprised, because we experience the same challenges. What we face is not different from other countries. As health professionals, we can exchange ideas, strategies, and learn from others, leading to a meaningful change worldwide. Pamela Njeru and Osandra Uyebi. And Gifty, we heard from Gifty. Peterson Kojo, Mustafa Borsinfai, thank you. Says great event. Tell us what you thought was great. Okay, so you work on the anthropology of vaccines in Quebec City. Esther Yakubu, we heard from Esther. Our organization is committed to this survey. Taban Anthony Stephen, it wasn't surprising. Climate change barriers are the same. Manisha Danan asks how you can access the survey. Just check your email, Manisha. I know that you received the email inviting you to take the survey. There is also a global health, climate change, and health website set up by Grand Challenges Canada. So we encourage you to go look at that. All right, it looks like we're not going to have time to go through all of the messages before we have to start the session for the Francophones. But once again, thank you and goodbye. I have many practical questions. All right. And we do have these links to make it easy with just one click to share this survey.